Alright, well, welcome to our Smart Mobility Connection Seminar. Today we're featuring Professor Branstetter. He is a professor of economics and public policy with a joint appointment in the Social and Decision Sciences Department. He's also a research associate of the National Bureau of Economic Research and non-resident senior fellow at the Peterson Institute for International Economics. From 2011 to 12, he also served as a senior economist for international trade and investment for the President's Council of Economic Advisors. Prior to coming to CMU, he was a Daniel J. Stanton Associate Professor of Business and the Director of the International Business Program at Columbia Business School. He has served as a consultant to the OECD Science and Technology Directorate, the Advanced Technology Program of the U.S. Department of Commerce, and the World Bank. He holds a Bachelor of Arts in Economics and Mathematical Methods in the Social Sciences from Northwestern, and he earned his PhD in Economics at Harvard in 1996. So, welcome, Professor, and we're very excited to have you. So, without further ado, please.
Thank you.
Thank you, sir.
Wow. I'm getting applause before I even say anything. I can tell I'm not in front of a bunch of fellow economists. Thank you very much for the opportunity to talk about this research. First of all, I come to you, right, as a representative of the Block Center for Technology and Society, which is a sister organization, if you will, of Metro 21 and Traffic 21, and we're already working together in a very productive way. I am here to talk to you about this project. Can ride sharing, or perhaps more accurately ride hailing, help the disadvantaged get moving? And as I do so, I want to acknowledge the financial support of Metro 21 and Mobility 21 and the Hillman Foundation. I also want to acknowledge the partnership and the in-kind support of Uber. I want to thank, without implicating, my co-PIs, Bebe Lee, who's a professor of information systems here in the Heinz College, and Lowell Taylor, who's the Heinz professor of economics and one of the top labor economists in the world. And finally, there are a number of people in this room, including Chris, who've given my research team some important feedback on the long road that we've been taking and are still on to getting this project off the ground. What I'm going to be giving you today is kind of a summary of work in progress. We do not have results yet, and we probably won't have our full results for at least another 6 months. I guess that means that any comments you have will be especially useful because we haven't actually done this thing yet. So if you can help us think of a way of doing it better or avoiding obvious errors, please speak now. Do not forever hold your peace. What this project is all about is it's really trying to do what the Block Center and I think to some extent Metro 21 and Mobility 21 are trying to do, which is to bring some of the possibilities created by new technology together with quantitative social science to help contend with long-standing problems for which technology may offer us some new solutions. And the problem that we're tackling in this project is the spatial mismatch problem, a problem upon which the transportation research community has had much to say over the past several decades. So social science research on the spatial mismatch problem and transportation research on the spatial mismatch problem goes back at least as far as the Watts riots of 1965. Right? Now, perhaps most of you were not even born in 1965. I have a sinking feeling that maybe some of your parents weren't born in 1965. But for those of us that were alive at the time, this was a really troubling event. In 1965, the Watts neighborhood of Los Angeles exploded. Days of rioting left behind millions of dollars in damage, and a clear sense that the social fabric of urban America was being ripped apart. And of course, Watts was only one of a series of episodes of urban unrest that would persist through the next several years. So the governor of California at the time, Pat Brown, which as fate would have it, is the father of the current governor of California, Jerry Brown, reacted to this uprising by appointing an industrialist and former CIA director, John McCone, to head a prestigious commission charged with investigating the causes of the riots, and what could be done to heal Watts and similar communities. Now see, back in the 1960s, when there was a big social problem, political leaders would respond to it by calling on experts to carefully consider the evidence. Doesn't seem like such a bad way to react to social problems. So the McCone Commission concluded that the lack of jobs and inadequate transportation of jobs played a large role in creating the conditions that led to the urban unrest in Los Angeles. And this wasn't just some government commission. I mean, in the transportation research community, to invoke the name John Mayer is almost like invoking Moses, right? I mean, he was one of the founders of the field. He led a group of social scientists that concluded that post-war changes in urban structure and urban transportation have caused a relative deterioration in the access to opportunities, if not in the actual ability of the poor. So this conclusion was rendered in 1968, and nearly 50 years later, when I was teaching a transportation economics course for the Institute of Transportation Studies at UC Davis, which is where I got my first full-time academic job, this was still a problem, right? I mean, the problem is that the poor in urban America live in particular neighborhoods, often for pretty ugly historical reasons. The jobs appropriate to their skill levels are in other neighborhoods, and it can be very hard for folks to get from their neighborhoods of residence to where the jobs are if they're relying on mass transit alone. Now, economists have gotten into this too, right? Economists know that labor force participation among the poorly educated is very low, right? For adults over 25, labor force participation is only 60% among those with a high school degree. It's less than 50% among those without a high school diploma. Right? And one likely contributing factor to this are these transportation costs within urban areas. And Walter Oy, very famous 20th century economist, recently left us, wrote one of the classic post-war economics papers on exactly this issue. Okay. But economists are a finicky bunch, right? And despite the plausibility of this, and despite all of the case study evidence, and even econometric and statistical evidence that's accumulated, for economists, the absence of experimental evidence, right, tying lack of transportation to poor educational outcomes is still something that troubles us as we're trying to think about how big this problem actually is. Right? Now, this absence of experimental evidence is maybe worth a couple of minutes of a digression, because, for the non-economist, this gives you a window into the twisted way in which we economists think. Right? So imagine that we have an isolated community, right, that's on the periphery of a major city. Perhaps some of you New Yorkers can instantly imagine what major city we're talking about. Right, and so, this is a little community, and that's kind of hard to get from here to there, where lots of jobs at various skill levels obviously are. Now, imagine that we can link this previously isolated community to the urban core with some really great public transportation. This is an artist rendition, by the way, of Elon Musk's Hyperloop, right, which strikes me as an idea that from an engineering perspective is amazingly cool, and from every other perspective is seriously wacky. But that's another conversation. Right, so imagine for a moment, right, that you've successfully linked this small community to this major urban center with oodles and oodles of jobs, and you observe that lots of people in this community are now working in this area. Right? That would seem to just sort of solve the problem once and for all, but what could be going on, right, is that residential choice of workers changes in response to major investments in public transportation infrastructure in a way that would complicate our causal inference. So, the existence of a rapid mass transit system between this picturesque island and downtown New York City makes it a more attractive place to live, right? So, the stockbrokers all move to, Fantasy Island. They push out the residents, right? And what you observe in your data, right, is that we've got a lot of people living in this place getting great jobs, right? And in some sense, it is a consequence of the mass transit investment, right? But the original residents that we might have been trying to help have actually largely moved elsewhere, right? And we can still say very little about the impact of this mass transit investment on their employment outcomes, okay? And, gentrification is a real thing. So, while I'm sort of putting this forward as an illustrative example, it's not purely illustrative. So what economists would love to have is a kind of randomized experiment where you take a group of poor people that are plausibly facing these transportation frictions, and then for some randomly chosen subset, you lower their cost of transportation, and you observe outcomes. And if this is all done in a randomized controlled trial, then the inference is very clear. Right? Because presumably you're holding all other factors constant. You're changing one thing, right? And you're observing the outcomes. There's not a study in economics that really does this, so far as we know, right? Me and my fellow researchers. And so we may have an opportunity to be the first, right? To deliver, this important piece of evidence. Okay. Right, so having sketched out this lacuna in the economics literature that we're trying to fill, let's relate this basic idea to our current context, right? So I think we might all agree, even those of us, hey Costa. Costa saw that it was me, right? And now he's going to leave. All right, so, I think all agree that, Pittsburgh mass transit is probably not ideal. Together with a group of Heinz master's students, we actually tried to map this out a little bit. So using U.S. Census data, we were able to identify neighborhoods in Pittsburgh with a high incidence of poverty, right? And I'll skip for a minute the details of how we defined it, but we did reasonable things, right? Using a separate census data set, we were able to identify districts where lots of low-skilled jobs are being created. And there are some cases where poor districts are immediately adjacent to places where jobs are being created in large numbers. Right? But there are lots of poor places that are pretty geographically distant from the places where jobs are being created. And what we've also done is we've overlaid the route structure of the Pittsburgh mass transit system. And what's probably immediately obvious, right, is that it's actually not that easy for lots of our poor who are living fairly far away from the urban core to get to the places where skill-appropriate jobs are, if all they've got to rely on is mass transit. We actually asked the Allegheny County Department of Human Services to give us a slightly different take on this, which they did. Okay, so they have great data on poor households of various kinds, including poor mothers, right? A lot of the existing social science literature suggests that this problem of transportation friction will fall especially heavily on mothers, especially single mothers with kids, because for this population, the opportunity cost of the time they spend in transit is very high, right? And so if we look at one plausible definition of poor mothers in Allegheny County and where they live, right, and the residential locations are given by these dots, we can see how that geographic contribution compares to the intensity with which different parts of Allegheny County are served by our existing mass transit system, right? So the all-days frequent service walk shed, the all-days walk shed, the 6 days walk shed, the 5 days walk shed. I don't have to explain to you guys what these things are, right? I mean, the color coding tells you how intensively the area is served by our bus and rail system. And what's immediately obvious, of course, is that not only are there people living far outside these walled sheds, but we've actually got meaningfully large clusters of poor people living outside them. Right? So we got a problem right here in River City, River City. Right? And the problem is that our traditional transportation technologies have significant drawbacks. Right? So expansion of mass transit is expensive for society. It's time-consuming. And it's an inherently inefficient way to move small numbers of people around the urban periphery. Right? I mean, all mass transit systems are basically designed to bring people into the core. Right? That's the way the network works. Right? But as both poverty and low-skill employment have become suburbanized, we increasingly have a transportation problem that conventional mass transit is simply not designed to deal with very effectively. Now, of course, for decades, social scientists, including economists, have been saying, well, why not just give poor people cars? But that's really expensive, right? And not only is it expensive, but a personal car is an asset that sits idle 95% of the time. And so making the case to the taxpayer that, what we need to do is purchase these expensive assets that are going to sit idle 95% of the time, that's not a terribly compelling, it's a hard case to make. And so for decades, we've known that this problem exists, but we haven't had good solutions because the two transportation technologies that were readily available were not very good solutions. But now there's ride-hailing, or as I used to call it when I initially applied for my Metro 21 grant, ride-sharing. Here's not ride-sharing, it's something slightly different, right? This is something that many of the people in this room, use frequently. Maybe we don't all love it, right? But I think those of us who are frequent users really appreciate how being able to rent a personal car only when you need it is a really amazing and useful addition to our transportation policy options. Now, the commercial players that are operating in Pittsburgh are, for the most part, pricing these services at a level that places them outside the reach of the poor folks that we'd like to help. But at some level, we could probably all imagine the outlines of a deal that might make these services at some point available to the urban poor. It could involve direct subsidies financed by the taxpayer. Right? It could also involve, at least to some extent, regulatory decisions made by the public authorities, right, that protect public safety and other public objectives, but create value for the ride-hailing companies as their business models evolve, on the condition that some of that value is used to provide free or heavily subsidized rides using this technology to poor folks. Now, as attractive as that bargain might seem to be, we really have no way of valuing it because we don't really know how and whether the people that we're trying to help would take advantage of this service, even if it were made available to them, right? So how could we know that? How could we find that out? Well, it seems like the best way to do that is to do a randomized controlled trial or an experiment in which you essentially take what amount to ride-sharing coupons and you randomly assign them to members of your target population, and then you can track the mobility of the treated group and the control group with great accuracy using data generated by cell phones. And this is the thing that actually makes this experiment possible, and we couldn't have done this 10 years ago. But now the diffusion of smartphones, even among the urban poor, has reached the point, right, where we can actually think about equipping poor single moms in Allegheny County to call Ubers, right? And because they have the smartphone that enables them to do that, and because they have a smartphone with GPS capabilities, we can use the GPS features on their smartphone to track their mobility. And that allows us to track the mobility of a treated group that's getting lots of access to this resource and a control group that's not. multiple times an hour, every day of the week, for months, so that we could get an incredibly granular, incredibly detailed sense of the difference this kind of treatment would make on the mobility of the treated group of working poor. Right? And if we find that this not only increases the mobility of the recipients, but also makes it easier for them to work more hours, it makes it easier for them to access training opportunities, it makes it easier for them to get better jobs, it makes it easier for them to help manage the health of their family, right? Then we could find that the income generated and the reduction of need for public services generated by this intervention would be so great that it could conceivably pay for itself, right? But even if it doesn't, right, we find evidence that it has a very strong positive effect on the lives of the families of the treated, then we're in a position to make a strong argument to the public authorities that this is something that we should invest in. You know, possibly invest in some less effective social program, a little bit less, and create the resources to invest in this. Now, the great thing about being at Carnegie Mellon, and in fact being in this building, is that all of the skills necessary to undertake this kind of study are right here. Right? So we've got economists who know how to run large-scale field experiments. We've got information systems people who can create the kind of custom software that would allow us to place these GPS tracker apps on phones and collect the data and collect it in a way that protects the privacy of the participants. We've got programmers who can build into this app the features that allow us to send short surveys via phones so that we don't have to put something in the mail and have it, you know, half of them thrown away or not reach the people that are intended. Right? We can follow up with our participants in a lot of interesting ways. All of those skills are right here. Right? Easily accessible. Let me pause for a minute. Right? I'm going to kind of move into some of the nitty-gritty details of how we're going to recruit, what the control group is going to get, what the treatment group is going to get, but let me just pause for a minute and see if people have any questions or comments. Yes?
Like, how would you determine how much surplus ride sharing there is out there? That there would be enough if you got a bigger group of people who would want to use it?
Right, so I guess the concern is that right now, you know, there's, you know, sort of a limited number of
I don't
riders.
know, I'm just
Yeah.
asking.
Well, you know, I mean, part of the nice thing about the Uber and Lyft model, right, is that at some level it replicates a marketplace, right? So if there's higher demand for ride sharing at a moment in time, then the price of the ride, right, the price received by the driver rises. Right, so that people who might have thought, well, you know what I'm going to do this afternoon, you know, I'm going to watch that cool Spike Lee movie, you know, then they get a ping, hey, you know, I can earn twice as much as I normally earn as an Uber driver. Excuse me, they'll say, you know what, the Spike Lee movie will still be showing tomorrow. You know, they get in their car, they join the driver pool, and supply expands to meet demand because prices are rising. Right now, of course, if prices are rising a lot, exactly when our moms want to use this service, then that means that they're going to get less transportation than they might otherwise get. You know, but you know, I mean, the nice feature of this business model is that it sort of adjusts supply and real demand using an equilibrating price. And so I'm not too worried that we're going to run out of Uber drivers, right? I'm a little worried, I'll be with you in just one second, I see the hand. I'm a little worried that, you know, when we first start this and the Uber drivers start getting these requests for rides from, you know, drivers without an extensive usage history, and they're coming from tough neighborhoods, that the response might not be quite as fast. You know, but here, you know, we've also got perhaps other avenues of recourse. So the Public Utilities Commission of Pennsylvania licenses Uber and all the other ride-hailing companies. And they have legal permission to operate under the condition that they serve all comers. And one of the commissioners is a Heinz graduate who's aware of this project. And so I think if we find strong evidence of rider refusal or slow responses, we can not only make this available to Uber, and the CEO of Uber, by the way, is supporting this project, but we can also make that information available to the Public Utilities Commission. So, I'm not sure that that will solve the problem, but maybe we can do things that an individual poor single mom rider couldn't do. Thank you for your patience.
I might be a bit biased because I'm a member of a group called Pittsburghers for Public Transit, but when I came in, I do believe, unless I'm mistaken, I heard something about you saying that transit was inefficient compared to this model, and I would beg to differ on that because transit, buses, and rail can move a lot more people and potentially at a lower cost per rider depending on where it's going. One such example we have is the P1, P2 East Busway is one of our routes that actually has enough ridership that it pays for itself.
Yeah, so let me be clear. I'm not arguing for a diminished investment in public transportation. I'm a public transportation rider. I think probably most of the people in this room are regular riders of the 61
And then a
ABC.
follow-up question to that then would, why not put this investment into public transit that definitely needs it more, especially like there's a study that covers this region that actually 60% of respondents in this region that took this study that covered multiple regions actually would prefer the investment go to public transit over something like this. And there's another study that shows that it's actually harmful to 25% of low-income users, despite what they're trying to claim.
Okay, well, I find it interesting that you are denying the truth of my claims before I've even explained our methods, and we have no results yet. But let's look at this map. We're not going to run buses to all the dots on this map, ever. Right? That's outside the politically feasible set. And yet each one of these dots represents a household that's potentially being held back by a lack of transportation resources. Right? So if we know that we can't serve all of these people with conventional mass transit, and we know that there's another technology that might help some of them, then from my perspective, I feel like we're morally obligated to at least experiment and study the possibility that this other technology might help folks who are unlikely to be helped much by any politically feasible expansion of the mass transit system. Yes?
So,
Lisa Kay?
in the project or the proposed study, will people be able to use their coupons for any kind of trips, or are they restricted to certain types, like for work or job training, or can it be used for anything?
That's a great question. And this is a debate that we had within the research team. And ultimately what we decided is not to impose any explicit restrictions, right, on the mothers who are going to be using the service. We will sort of make it clear to them, right, this is a study about removing transportation barriers to create better employment outcomes. But we're not going to redline. The Uber technology that we're using actually allows us to redline certain addresses. Like we could redline the sports stadiums, we could redline the bars. We're not going to do that. We're going to leave it up to the moms, right? Partly because we think the moms might be using this resource in ways that we don't anticipate. And by allowing them the freedom to use it how they see fit, we may actually learn something useful that we didn't even anticipate learning. Although, because we're tracking both, the pickup, drop-off, and route of subsidized Uber rides and their location more generally, we may in some cases be able to infer where they're going and what they're doing with the resource. And we may even be able to infer when what they're doing with the resource may be different than what they're indicating they're doing with the resource in their communications to us. But I hasten to add that when we do analysis that brings our GPS data, our communications, our survey communications, and the Uber data together, right, we're going to anonymize that merged data set. So that when we're doing our statistical analysis, we won't know that it's Miss Jones that's in the middle of Shinley Park at 2 o'clock in the morning, and she keeps taking Uber rides, to and from Shinley Park, back to her neighborhood in the wee hours. right? We're not going to know that it's her. Okay. Yes.
So, one of the questions I had was whether within the study you'll be working with, for example, Pat, to look at the effects of the subsidy on public transit, right? If there will be a cannibalization effect at all, or to quantify that.
Right. So we're actually hoping for a complementary relationship rather than a cannibalization relationship. And one of the things that we're trying to do, I mean, in the suite of apps that we're creating that will go on the phones of our participants, Control and Treated. One of these will be this app that we are struggling to create that will allow people to see, okay, you want to get from A to B, right? Here's how fast and here's what it would cost you on Uber. Here's how fast and here's what it would cost you on public transportation, right? And then here's a way of combining an Uber ride with a bus ride that saves you some time relative to pure mass transit, but it saves you some money relative to pure Uber. Now you'd think that a product like this would exist in the marketplace, right? And I think Uber's working on a proprietary version of this that perhaps for obvious reasons they don't want to share with us, right? We've got our information systems students trying to work on a version of this that delivers, a reasonable combination option on demand. And if we actually manage to pull this off in the next couple of months, then this will be part of what every participant gets. So, it could actually lead to more mass transit use, right? But we're not going to have, I think, a really well-defined counterfactual to be able to say something specific about that. The best that we may be able to do is compare what the control group are doing with what the treated group are doing, right? And we won't be able to track their mass transit exactly, but as we see this trajectory of multiple pings, right, over the course of the day, we may be able to infer in some cases, during this hour, right, number 1267 was on a bus. So that's not a complete answer to your question, but that's the answer that we have. Yes?
Forgive me if you're going to address this in the next section already, but a question that came to mind directly since the whole kind of purpose of this study was the idea that economic opportunity is what we're trying to provide, getting people to places of employment, for example. How are you planning to address the possible ethical concerns of if you're giving advantage to people for a period of time, for the study period, it might open up economic activity, it might open up job opportunities, for example, and then there's going to, of course, be some end to this period that you're actually inviting people to participate in areas of the economy that might not be open to them as soon as the study finishes. Is this something that's been considered though?
We have thought a lot about this, right? All good things come to an end, including our study. So what do folks do when our study ends and the treatment ends and they don't have access to a couple $100 worth of free Uber rides per month? So, various people around campus are actually working on an app that facilitates carpooling among regular civilians, right? I'm going from A to B, right? Would you like a ride? How much would you be willing to pay for a ride? That would be one resource that we could connect people to. But Lisa Kay knows very well that there are other resources that we could connect people to, provided, right, that the movement that we induce isn't entirely random. What I expect to find is that we're going to have clusters of moms in particular neighborhoods who are moving from their neighborhoods of residence to particular places elsewhere on the urban map where they all have jobs. And if we've got clusters of people with highly correlated transportation needs, then there are existing programs that can help set up van pools, right, with temporary subsidies, right? So perhaps that's not a permanent solution either, but that extends the horizon over which people are getting some public resources from a few months to possibly a few years, right? And, part of the problem with these programs, right, is identifying the clusters of people that have highly correlated transportation needs. At our current levels of funding, we're hoping we can induce as many as 650 moms to enter the study. Now, this will be split equally between a control group and a treated group. But that's several hundred people in the treated group. And again, if we're lucky, right, at least some of these folks will be in or close to these clusters. Right, so we can give them something, hopefully. But not everybody, right? And this is something that we thought about. We still think that the advantage to the participants and to society is sufficiently great that we should go forward with this, even if there is some risk, right, that a particular individual might be committing themselves to an employment pathway that becomes difficult to stay and study it. So, in every field of research we run into this, right? The cure for cancer may make some people sick. Let me take some hands in the back, including you at the very back.
So I've heard that this has actually been done by Uber before. I think it might be with Travelers Aid or like a program in New York. And I was wondering if you know like how effective these programs have been. Because what we've heard was like if we're thinking in terms of the senior population, like these voucher codes, it's difficult for them to manually enter it into the apps and stuff like that. I was just curious whether.
Yeah, so this isn't going to target the elderly population, right? This is targeting women with children who are young enough that they're still in the home, right? Because again, we want to focus on this population because we think the incidence of transportation cost barriers are especially high for poor moms. The closest thing to what we are attempting, is an experiment that involved using Uber vehicles as an alternative way for, poor people to get to their health care, right? As I understand it, and I may be misremembering the details of the study, it wasn't just the pure Uber model where you get the car exactly when you want it. There was some kind of pre-scheduling feature. And what they found out is that this didn't necessarily improve people's adherence to their healthcare regimens or significantly increase their access to care. But that's a different question than what we're trying to test, right? Now, there have been various pilot studies that have tried to supplement public transportation by using additional access to Uber. But what nobody's done is adopt this explicit randomized controlled trial framework where you have a large group, right, and then they're split into a demographically equivalent treated and control, and then you're really able to track in a very granular way the difference in mobility between these groups as a consequence of the treatment, right? And I think one of the reasons why Uber was willing to partner with us and provide in-kind support is because it had this feature, right, that there are some of their other, sort of research partnerships have lacked. Okay, I'm going to make sure I'm moving around. Yes, Bashur.
Yes. What was the reason for focusing on single moms? There could be households that make much, low income, but it could be headed by a poor man. And because one problem with single mom is that childcare costs in the U.S. is very expensive. So one constraining factor for moms to go to their job could be that they couldn't find someone for their children to be with while they go to work. So was it possible to expand it to men or just single mom?
Yeah, so you're absolutely right about childcare. Right, and so one of the little pieces of information that we can push to our study participants, the treated and the control through our app, is information on low cost or even zero cost childcare sites that might be outside the immediate neighborhoods of these women. But you're absolutely right. The failure of the United States to provide adequate childcare for working moms is a serious public policy failure. It's persisted for decades. I wish it weren't so. And I have no doubt, right, that this is going to moderate and limit the employment response of the women in our study to the treatment that we're providing. We nevertheless think that even if we can't solve all their problems, right, even if we can't solve their childcare problem, if we can help solve the transportation problem, we still may get a response in terms of people working more hours or finding better jobs. It's just a statistical fact that the number of single-parent households headed by men is extremely small. Right? almost all of the single-parent households in the United States are headed by women. You know, and guys, that says a lot of seriously bad things about us, but it's a fact. Yes, I'll just answer questions, right? I mean, I have a bunch more slides, right? But it's probably more useful for me to address questions. Yes, go ahead.
Could you talk a little bit more about how you're evaluating the success of the studies? Are you looking at
Sure.
mobility alone? Are you looking at the quality of the jobs, the number of hours worked? How are you really evaluating, not just are they mobile, but what types of jobs they're getting and where?
Right. Great question. Great question. So something that I haven't mentioned yet, you know, is the fact that we have an opportunity to partner with the Allegheny County Department of Human Services. Right. And the Allegheny County Department of Human Services not only has great data on where poor single moms are, and even information on their cell phone numbers and email addresses, which enormously facilitates the construction of a representative random sample. Right. So that's like a key input into our process. But a lot of the moms that we're targeting receive social services, right? They're on TANF, they receive SNAP, their households are on Medicaid. Their kids attend schools that report attendance and achievement data to DHS. We even have information on the interaction between this household, you know, and the criminal justice system or the child welfare system. So there's a lot of data on these folks. And that data even extends to state administrative data on incomes collected through the state unemployment insurance system. Okay? So there's not a perfect match between the households that we will recruit, right, and the households that can be matched to state insurance records. But there's a lot of correspondence, right? See ya. So, I mean, this opens up a lot of interesting opportunities to look not just at short-term effects, but longer-term effects, right? So even after these households leave the study, as a consequence of participating in our study, do they get a job with health insurance so that they're no longer on Medicaid, right? Do they have less demand for social services? You know, were they on TANF and now they're off TANF because their income has gone up? Right? I mean, you know, what's going on in terms of children's school attendance? In principle, we can track a lot of things during the study and even afterwards. Right? Now, this, you know, this requires information sharing between us and DHS, right, which participants would have to consent to. But in principle, it's pretty cool, right? We're going to be sending them monthly surveys, right? And they get a small amount of money for every survey that they fill out, right? So that's an additional incentive to stay with the study and fill out the surveys. These are going to the treated and the controlled, right? So we're asking them, you know, did you get a new job? You know, how many hours are you working? You know, what's your hourly wage? Did you participate in any training activities? So we'll be gathering data, but it's really useful to have an independent source of information on wages and earnings, at least for a subset of our participants, so that we'll be able to cross-validate. Does that address the question? Yes?
Yeah. Curious, can you expand on the validity of the experiment as far as both internally, looking at whether weather or traffic construction has affected people's use of rideshare versus public transportation, and also externally looking to see if the results could be transposed to different cities, especially a city like Detroit that is much more spread out and has less extensive transportation system, versus New York has a little bit more of expansive transportation system.
Yeah, so I mean, as we seek to publish part of this in the economics literature, one of the big questions that we'll get is generalizability. Right, and while on one hand we'd like to think that Pittsburgh is this all-American city, right? It's just kind of like a perfect reflection of the nation at large. That's not quite true, right? So there's a limit to how far we can generalize, right? I mean, there's going to be a geographic bound to the extent of our study, right? I mean, this is Allegheny County because that's where some of our data are coming from, and Pittsburgh does have its own particular demographic characteristics, which we really can't escape, right? So ultimately what we need, of course, is for a bunch of similar studies to be done, all of which have to extensively cite the first study of its kind, which will be ours. That being said, there's a whole group of American cities that look like Pittsburgh in a lot of important ways, right? And I think at least to that, generalizing from Pittsburgh to that subset, which contains millions of American families, would be a lot easier, right? So I think it would be easy for us to make the case that what holds true in our study holds true beyond the political boundaries of Pittsburgh and Allegheny County. I think we're going to have to exercise appropriate caution in trying to extrapolate from our results to Atlanta or Los Angeles or cities that are very, very different from us. And you were asking a question about internal validity, but I'm not sure.
As far as whether things outside of the experiment, like weather, affects people's use of transportation, as far as I was thinking, for example, if someone could walk to the bus or walk to their work when the weather's nice, but when the weather gets cold, they're more likely to use a rideshare. I'm curious if you've looked into that as a control.
Yeah, so again, the granularity of our data really help, right? Every time a study participant takes an Uber ride, we'll know, right? Because that ride has to get charged to our research account, right? So we'll know that study participant 12690, right, got on a bus, at Murray and Forbes, got on an Uber at Murray and Forbes, and went to, the South Side, right? Which happens to be the place where they're at 5 days a week during working hours, right? And since we know the time, we can go back to the weather records, right? And we can actually see if people use this service with particular intensity when inclement weather slows down the bus service. And to be honest, we're thinking that one of the most valuable aspects of our treatment for the treated is exactly this, right? If you show up late for work in a lot of these jobs, you could get fired, right? That would be an economic catastrophe for your family. And we've all had the experience of the bus running 30, 40 minutes behind schedule, right? Most of your professors aren't going to expel you from Carnegie Mellon if you're late for class, right? A lot of people in working class jobs don't receive that same degree of leniency, right? Appreciate the privilege that you have, folks. So what our experiment will enable these people to do is reduce the likelihood that they're going to get fired because the bus delivered them late, right? They'll be able to make that trade-off themselves. I know if I take a ride now at a surge price of 2x or 3x, I'll have less money, but it's really valuable for me to make sure that I arrive work on time, and so I'm going to make that trade-off. And if they're in our treating group, they can. Right, so we can pick this up from our ex post data analysis, and we expect that something like this to be there. Okay, I'm trying to keep track of how long various people have kept their hands up. I also want to have some equality between the different halves of the room. I'm going to go over here to the far left.
Are you going to be charging people different amounts, or are you going to be charging them all nothing?
So the rides that we provide will be free to the participants. Okay. Now the value of that will obviously depend on time and the level of demand and a lot of other factors. Some of which we might be able to measure and others of which we won't. Okay. That's probably an unsatisfactory answer to your question. But
Do you think it'd be a good idea to test different amounts of subsidies?
Yeah, so in a follow-on study, I think that would make a lot of sense. As it is, we've struggled a little bit to try and pare this down, to a set of questions that's both, rich and multidimensional, but manageable, right? And if we start, varying the amount of the subsidy, in a sense, we would not want that to be confounded by demographic differences between the treatment groups, and then we'd be splitting our sample, and we might be running into some power issues. So we have to impose some discipline and simplicity on ourselves, right? But again, this is something that a follow-on study should investigate. And of course, I hope that there are many, many follow-on studies, all of which will be scientifically obligated to cite this one. Yes?
So, assuming that low-income groups of people are living in clusters of low-income areas, do we know that those specific areas do have enough Uber drivers currently? Because if there are not a lot of individuals with cars in those areas, are we going to have existing Uber drivers travel that far?
So, I mean, of course, Uber drivers are kind of this cloud that's, moving across Pittsburgh. And, the exact nature of the cloud differs depending on time of day. I mean, we don't know for sure, right? At an early stage in our research process, we took this early kind of crude map of, poverty and job creation in Pittsburgh, and we shared this with Uber. And we said, okay, and this was a GPS data set, right? So we said, okay, take this, geographic data set and compare it to your cloud of Uber drivers, right? Are you going to have problems servicing our poor people? And they crunched the numbers, right, in their secret room, right, using their black box. So who knows if they're lying to us? But what they said was, time to service on average should be about 10 minutes. So we'll see, right? But this is what they presented to us in good faith, or we hope it's in good faith. Yes?
So I have a question about the supply and with the scarcity of ride-sharing coupons. I'm assuming there's not going to be like an unlimited supply of them.
No, we're going to have a regular monthly allocation for people in the treated group.
Okay.
Right? And that'll be steady throughout the experiment.
Okay. So is it possible, in the long term, if to decide if people are using it less or who's the most deserving to get the ride sharing coupons? I don't know the question.
No, I think I understand what you're saying, right? And again, we have a limited budget, right? And we have a limited intellectual bandwidth as well, right? So, rather than try and come up with some mechanism, right, that might allow study participants to reallocate the allocation of free rides among themselves, like kind of an internal marketplace, we wanted to focus on something fairly simple and straightforward, right, where we could make clear causal inference with standard statistical methods, right? So beyond the shadow of a doubt, there are going to be some people in the treated group that will have less use, right, or less need, right, in some deep philosophical sense for the treatment than other people in the treated group and some people in the control group. Right, but here we're not trying to design a mechanism that would achieve maximally beneficial allocation of the resource. We're doing something much simpler, right? In a randomized controlled trial, does this make a positive difference on mobility, employment, wages, other measurable outcomes, right? And we think that's valuable, right? Even if it leaves as a focus for future research. Thanks, Karen. Thank you for your financial support.
Of course.
Even at least as a future question, what mechanism should we use in some future where we have a lot of these to allocate them to the households with the greatest need? Yes, please, Kay.
Kind of going back to the subsidy question that you had asked about, will there be anywhere in the research notation about the subsidy that's already being placed on the cost of the trips through the private investment to these ride-hailing companies, that the price that's being charged to the consumer is already subsidized? So what would the true cost be to the population if that's gone and the real price comes up and that needed to be subsidized at 100% versus what it is right now?
Yeah, so that's going to be outside the scope of our research projects, right? I mean, I would presume there are other people, at least people on Wall Street, right? I mean, crunching the numbers and trying to figure out, how much cash Uber and Lyft are burning, how much investor cash they're burning to build market share, and what a sustainable price would look like. Right?
Yeah, I'm just asking if there'll be a notation that we know at some point, if this would be adopted by a community, the price to underwrite the trips are not going to be the price they are today.
I think that's sort of axiomatically true because all prices change over time. right? But do we know that as it gets easier and easier for individuals to connect to each other, you know, for all kinds of reasons, including a desire to share rides, that the marketplace won't become somewhat more competitive over time? I mean, do we really think it's going to be a kind of one-sided duopoly, right? You know, Uber's here, Lyft's here, everybody else is here not doing much. I mean, is that the market structure that we're going to see forever, right? Or as it gets easier and easier for individuals to reach out to other individuals and kind of do this on a more informal basis, the number of players might grow, and the degree of market competition might expand, and the price might not rise that much. I mean, I don't think we really know what the future of ride-hailing really looks like at this point, but I think there's a lot of reason to believe that it's not going to disappear, right? I mean, it provides too good a service, right, such that even if the price point were to change a little bit, I don't think that people will abandon it. Right? I mean, the ability to intensively utilize these assets, rather than the bad old way of all of us owning cars that sit idle 95% of the time. I mean, the economic and engineering logic behind that is just too great for it to disappear from the face of the earth.
You take the target audience as single mothers who have children.
For our experiment, yeah.
Right. So when they have to go to the daycare and then to their job. So will the Uber driver wait at daycare while the children are being dropped off, or will they have to get another ride from the daycare to work?
So I mean, frequent Uber riders know this, right? I mean, there's a way to add multiple destinations to your ride, right? So I mean, the short answer to your question is, we don't know exactly how the moms are going to choose to use this service to access both daycare and their employment. And there will be frictions, right? I mean, Uber drivers are not obligated to have a car seat in the car, right? So if you want to take a small child with you to daycare and then you want to go to work, then you've got the challenge of taking your car seat, putting it in the Uber car, and of course you don't necessarily know what Uber car you're going to get, right? So a car seat that fits very well in a Cadillac Escalade might not fit so well in a Honda Fit. So, I mean, this is not going to be ideal, but I wouldn't be surprised, right, if some moms actually do this, right? They get pretty good at putting car seats into different kinds of cars, and they're able to combine a trip to daycare with a trip to work. We're not giving them an unlimited monthly allocation, so they're going to have to be pretty smart about using this resource. But this is also something that our moms may tell us, and even if they don't, we may be able to infer from the trip data, right? I mean, we notice that they're going to some place which is not their workplace, and they're going there every day, and they're arriving before working hours start, right? And it's a daycare center, we can probably make some inference, even if they're not telling us.
I think we have time for just one more question.
Oh my gosh. See, if I were a real economist, I'd have you guys bid. Okay, all right.
Great.
Since you gave a notional bid.
Well, I want to thank you for fielding so many questions.
Happy
It's
to do it.
obviously a topic of interest and importance to everybody. I did want to ask/comment furthermore on the implications of your research for transit again, because it seems like what you're creating with this study is actually a sort of a planner's dream come true in terms of, examining where demand might reside, and it might actually get at the generalization question that someone asked earlier in terms of, I'm assuming that one of your criteria for region targeting is to look at transit deserts, right? So it seems like there could be potentials for your research to take a look at travel patterns that could be either serviced by rideshare or by further public transit investment. And I don't know if that's something that you're thinking about, but it sounds like it'd be great.
Yeah, so we had a bit of a back and forth within the research team of to what extent do we want to oversample the transportation deserts, with me pushing initially pretty hard for that, right? Because it seems like this treatment would have the biggest effect there. And with my labor economics policy, my labor economist colleague pushing hard in the other direction, saying that the geography of transportation deserts is pretty particular to individual cities. And we want to study, where's my generalization guy? We want to study that will be as generalizable as possible, right? So if we have like just a random sample of poor moms, the scientific community knows how to think about that. If we have a sample of poor moms that's skewed in some way that's difficult to explain to particular geographies in a particular city, then it actually becomes harder for the scientific research community to interpret our results. That having been said, right, we know where these women live, right? We know that some of them are in transportation deserts, right? And if our data are rich enough and our treatment effects are strong enough, we might be able to break our sample down into treated versus control that are in a similar transportation desert versus treated versus control that are in a place that's relatively well served by existing mass transit, right? And we can look at that difference. I mean, a more complete answer to your question is, at the end of the project, we're going to have terabytes of data that are tracking poor moms in Allegheny County trying to make a life for their families. And we're going to utilize a little bit of that data in our research project, right? But looking out further, we would really like to find a way of making this data treasure trove available to the research community in a way that protects the privacy of the participants, right? So probably what we need to do is change their addresses randomly, right? We sort of randomize the address, or we don't let the recipient of the data actually know where they're coming from. It's like a 3-block radius or something like that. Right? But simply by looking at these 4 times an hour GPS pings, right, and relating it to all that we know about the social and urban geography of this city, I think we're going to learn a ton. Right? And our research team doesn't possess all the expertise required to squeeze all the learning out of this data set that I think we could eventually get. But wouldn't it be great if, Pittsburgh and Carnegie Mellon become, globally recognized as a center for this research, because we've got the data, right, and other people have to come to our data to study these phenomena. So that's part of the broader vision.
Yeah.
All right.
Well, thank you so much, Professor. It was a great talk.
Okay.
Thank you, everyone, for coming.
Okay. And thank you for only allowing me to get halfway through my slides. That was awesome. That was awesome.